You might think GLP-1 receptor antagonists like Ozempic and Mounjaro are miracle drugs that are finally helping you lose weight and control blood sugar. But what if I told you these drugs come with a few major consequences? Today, we'll review what these three risks are and how you can prepare for them. These drugs have become extremely popular over the years. It's estimated that as many as 19% of adults aged 50 to 64 currently use or have used them to manage all sorts of health issues. And this number is growing. Every year, more and more adults are using Ozempic to manage chronic conditions like type 2 diabetes or cardiovascular disease. GLP-1 meds like Ozempic and Mounjaro have many benefits and help millions of people every year. But recent studies have shown that there are some significant downsides to using these drugs, especially for adults over the age of 50. They're sometimes marketed as this harmless, holy grail of medicine, but the reality is that they are much more complicated than that. I'm Justin, by the way. I'm a doctor of physical therapy and own a PT practice with 7 locations across Southwest Florida. We treat many senior patients on GLP-1 medications every year, and I've seen firsthand what happens when adults start taking Ozempic without fully understanding what it can do to their metabolism, hormones, and even their brain. Now today I'll be breaking down the consequences of these drugs. No fluff, no pharma spin, just the real risks and what you'll need to watch out for. The first major side effect and consequence of GLP-1 drugs for over 50s is muscle wasting. This is something that has surfaced only in recent studies over the past 2 or 3 years. The key concern here is that after the age of 50, adults can expect to lose 10% or more of their muscle mass per decade anyway. This is natural and a somewhat scary part of aging. The worry is adding a drug that causes muscle wasting to naturally occurring muscle loss can be a recipe for disaster, and the effects can be exponential. I should clarify, I'm not advocating for you to stop taking your GLP-1s prescribed by your doctor. These medications can be extremely helpful in treating many different medical conditions and provide tons of benefits. But is there anything we can do to help with the muscle loss? Fortunately, there is. The bottom line is that if you're over 50 and you start taking GLP-1 drugs like Ozempic, you need to make resistance training a part of your daily routine. If you're over 50, you should be doing this anyway. But it's even more important if you're taking GLP-1s. Now, I'm not saying you have to be lifting weights all day, every day. Just 30 minutes, 3 times a week should be enough. Just remember, the key is resistance. You should be challenging your muscles using body weight, bands, and weights whenever you can. For your legs, you can do squats, sit to stands, step ups, heel raises, side stepping, glute bridges, and split squats. For your upper body, try banded rows, countertop push-ups, wall walks, bent over rows, or chair dips. There are tons of great exercise suggestions and demonstrations on our channel, so be sure to subscribe and turn on notifications so you'll never miss a new video. 30 minutes, 3 days a week with a rest day in between. That's the ticket. Remember to focus on resistance. It's okay to feel tired and even a little sore after working out. That's normal. That'll actually help you counter the muscle loss effects of your GLP-1 meds and allow you to maintain your strength and independence while taking these medications. A 2019 study estimated that 46% of older adults don't consume enough protein in their food. Another key to fighting muscle wasting effects of GLP-1s is to make sure you're eating enough protein. A general rule of thumb is to consume about 1/2 gram per pound of body weight. This can vary based on your individual needs, but if you're 150 pounds or 68 kilograms and over the age of 50, you should be taking in about 75 grams of protein a day. If you're 200 pounds, 100 grams of protein per day, and so on. By focusing on these 2 areas, you can maintain muscle mass while taking these medications. The second thing to look out for is a loss of energy caused by hormonal effects. GLP-1 RAs also affect hormone levels in both men and women. Many of these effects can have positive results, but a few can be problematic for some patients. Again, these side effects are not as common, but they do impact some patients and can be particularly important to monitor if you're over 50. We aren't going to dive deep into this in today's video, but if I were you, I'd add it to your list of things to talk to your doctor about. The third and final risk that we're going to talk about today is related to your gallbladder and pancreas. A recent 2022 study in JAMA found that patients have an increased risk of gallbladder or biliary diseases, especially when GLP-1 RAs are used at higher dosages for longer durations and for weight loss. The side effect is relatively rare, but it's something to consider when starting GLP-1 RA treatments. The key takeaways: be sure to stay hydrated, exercise regularly, and maintain a gallbladder-friendly diet with increased fiber, limited high-fat, greasy foods, and regular balanced meals. There are other side effects to consider with GLP-1 RAs, but we think that these three are particularly important for adults over 50 and something that you can control. These drugs have enormous benefits and can help with so many chronic health issues, but it's important to consider their potential side effects and know how to mitigate these risks. This video here shows you how to reverse muscle loss for adults over 50. Even if you're not taking GLP-1 medications, I'll see you there.